better. But we're talking mostly about the Nanofat today, but they're kind of the same thing. When you harvest fat from some part of your body and transfer it to your face, you can do it in larger droplet size or micro droplet size. The microfat is just larger droplet size fat particles. And so it has more structure and more lift. So if you think of it, that they're a little bit larger size, but they're still really small. But they can go and they can lift your cheeks or lift out your temples, or they can just do more lifting and filling versus the Nanofat, which is more of a smoothing thing. And I just think it sounds like icing on the cake is the Nanofat, whereas the substance underneath is the Microfat. Just keep that in mind as he goes through his few slides. We only have a few slides, and we're not going to talk for a long time.
I'm going to use just this picture as a good starting point just to talk about a little bit of the aging process. This is just a good little cartoon picture to help you understand what happens with time, because that's what we understand so we can choose the right treatment for you. So we kind of have a decades picture, your 30s, your 40s, your 50s, and this is kind of simulating, something that might change over time. A very thin, attractive face, and what you're seeing is a few things. You're seeing that there's a shrinkage that's occurring. The face is becoming a little narrower, a little more hollowed, and we're seeing the effects of gravity, things kind of coming down. And the skin is also changing. There's some lines and wrinkles. So these are the major areas we're trying to treat, where we have fat cells mixed in with our stem cells. When we break it down further, we actually destroy some of the larger fat cells, and we get the smallest cells, which include stem cells, and that's our nanofat. So we have microfat and nanofat. So that first patient I showed you, she had a microfat procedure. The other thing that's improved in our techniques is PRP, platelet-rich plasma. Has anybody had a procedure with PRP at all? So we use PRP pretty routinely in our practice. We've used it for a while now for a lot of our skin treatments. I'd say the most popular way of using PRP in our office is either our skin pen microneedling treatments, where we do some microneedling to the skin and we lay your PRP over there to improve the results, or some of the lasering techniques to the skin. So PRP is something that's in your own blood. We actually draw your blood, draw just about 8 milliliters, very small amount of blood. Again, we have a technique for purifying the platelet-rich plasma. And in this golden plasma that you can see that Liz has a syringe, she does a lot of this for us. A lot of growth factors that are important for injury and healing. So PRP is not applied just for our skin and our face and aesthetics. It's actually used in medicine for quite a number of other procedures for healing, orthopedic procedures, arthritic changes, and we're still learning more about how it works as well. So Dr. Picerno and I have done for many years are part of what we're doing to get this nanofat. There's a simple harvesting of fat from your body, usually your leg or your abdomen, with a very tiny cannula. And we harvest those cells, and we have a special process that allows us to isolate the portion of that fat that can give us some nice improved results. With the fat, we have a really potent combination that can be used for treatment. So we ended up with a product you can see me holding there that just fits into a syringe, and we can put it through a very small needle like we use for fillers. Okay? And so the nanofat is this super fine product that includes stem cells, it includes the platelet-rich plasma, and what we find is that when we inject it into the skin, which is much more superficial than when we could put the microfat, it has these rejuvenation properties, these healing properties. So in terms of what we're treating, the nanofat is a skin treatment. The microfat is more of a volume treatment deeper under the skin.
Growth factors that are in fat cells being so close to the skin surface, they emit something that causes the skin to look better. With nanofat, it should be even better.
I'm showing you the picture just to give you a little idea what the downtime is in terms of swelling. It's not too bad overall. That middle picture is about 5 to 7 days after the procedure. So she's definitely has some bruising on the face. She was able to cover it up with some makeup. And then the picture to the right is about 2 weeks after the procedure, and there's still some signs of a little bit of bruising, and she has a little bit of some of the discoloration. I'm not trying to show you results, because the reality is the results do take even months to fully mature, and we want to get an idea what her downtime is going to be like, what the bruising's like. So that's why we're showing you that. I think that's all I have.